The National Health Insurance Scheme is intended to facilitate the provision of accessible, affordable, acceptable and quality healthcare services to Ugandans irrespective of their age, economic, health and social status. Sarah Byakika, the Commissioner for Planning, Financing and Policy in the Ministry of Health, addressed the press in Kampala.
So even the accredited providers, they'll ensure that they efficiently and effectively utilize the available resources to ensure that the population can access quality health services.
If passed into law, it will be mandatory for every Ugandan above 18 to pay for health insurance.
In case of a person whose income is derived from salaried employment, a monthly deduction will be made from your salary by the employer, and a contribution will also be made by the employer to make your total contribution.
Dr. Frank Asimwe, a urologist with the Mulago Hospital, says the policy is long overdue.
For starters, the hospitals will have money available to use, depending on how they play it. So that even if an unknown patient, poor patient, one who has been brought by the police is dumped into your care, there will be some drugs in your store for you to begin rolling things.
And in case of a person whose income is derived from self-employment, whom we call the informal sector largely, they will make an annual contribution in a manner and a rate as may be determined by the regulations that will be made.
Asimwe points out that some clauses that give relatives and friends a chance to save their loved ones must be incorporated into the bill.
There should be a clause where someone can donate a balance of their insurance premium for that year, and if their relative is sick and the money on their card is not sufficient, one or two of the relatives who have got a good balance or any balance on their card, they can come and donate either the balance or some sum out of their cards.
It is not certain when the bill will be presented to Parliament.
What is critical really is the discussion is now going to begin for purposes of enacting the law.
The scheme had been projected to start in the 2018-2019 financial year. Currently, about only 200,000 Ugandans have private health insurance. As the nation takes this new dimension to cover healthcare from the grassroots level to the upmost level of this nation, many queries have been raised about the scheme. But in the region, it's only Uganda that has not subscribed to this policy. Andrew Chamagedo, NTV Tonight.